Hello, greetings,
Hi,
Dr. Arailym. How are you doing today?
I'm doing good, Dr. Han. Thank you. Nice to meet you.
Nice to meet you too. So, how has been your day so far?
My day's been going well. Yeah, I just went for a walk and did some house chores. Nothing much. How's your day going?
Good, good. Thanks for asking. So, tell me a little bit about yourself.
Absolutely. And thank you for this opportunity to share my application with you. So my name is Arailym. I'm coming from a country called Kazakhstan. It is located between Russia and China, and actually not that many people know about it, but it is known for its nomadic culture and delicious food. So, growing up, my family faced certain difficulties with access to healthcare, which inspired me to go to medical school on a full scholarship, and I graduated just recently in June 2023. During my medical school years, I had incredible opportunity to work with amazing faculty in different countries and do rotations. And one of those rotations in China, I actually decided to do my residency abroad. And we know that the US offers the world's best clinical training. So currently, I'm a clinical extern at Interfaith Hospital, and since I'm done with all my steps, I just have a little more time to do my rotations. And outside of medicine, I really like basketball. I'm a huge Kobe Bryant fan, and I learn languages. I'm fluent in Russian and Kazakh, and I really want to learn Spanish. So yeah, nice meeting you again, and excited to get to know you too.
Wonderful, wonderful. That's some journey. So, does your medical school in Kazakhstan, does it have like the core rotations in China? Was it a way elective?
So it was an Amgen scholarship program. It's a summer research program, but during that time, I was also lucky to get to know some physicians and do some, rotations
Okay.
and shadowing too.
Okay, very good. So tell me about basketball. Is it a very famous sports in Kazakhstan, or you got more interested in it since you came here?
So I played in high school. I think it is quite popular. We have our national basketball team too.
Mhm.
So yeah, it's quite popular, like football, or we call it soccer here, right?
Yes, yes. I'm from Pakistan. Yeah, yes. So we the soccer, the game which they call it soccer here in Pakistan, we also call it the football.
Yeah,
Okay.
so same back
All
home.
right. So tell me, what makes you interested in a residency program in New York City?
Sure. So I think it's a really good training, and I did many of my rotations here in New York actually, and I really enjoy working with diverse patient populations. And I'm also really passionate to work with underserved communities. So this is something that really attracted me to New York. Also, I think program camaraderie is very something very important for me, and I heard a lot from residents that people are very friendly, people are very approachable,
Mhm.
and I would really enjoy to stay in New York City too. It's so beautiful. Brooklyn Bridge
Mhm.
Park, Madison Square. I really enjoy living here. So yeah.
Wonderful. Yeah, New York City can be very addictive. Once you are there, it's difficult to leave. Okay, that's pretty good. So, Dr. Ilam, tell me, if I ask you, what is your biggest strength in your opinion?
My biggest strength. Yeah, I know that many people have probably different strengths. Mine would probably be adaptability. So, yeah, again, I was very lucky to live in different countries and sort of adapt to different cultures. So,
Mhm.
here in the US, in China, in Kazakhstan, when you see this variety of clinical pathology, meet patients with different cultural backgrounds, you learn um, how to work pretty much anywhere. So, for instance, in China, we know that many patients they're not native English speakers; they speak Chinese primarily, and I didn't know Chinese, so I needed to, talk to my mentors, ask them
Mhm.
to translate for me, talk to nurse practitioners for them to help me with this whole process of patient care, and so we can deliver the best care possible for our patients. So this kind of experience has really, I think, made me adaptable.
Very good. And I think adaptability is one of in my personal opinion, it is one of the biggest strength, which in our program, there are a lot of IMGs, and I see them that they are very adaptable as compared to some of the even AMGs we see, but that's pretty good. Now, again, similar to what I asked, so in your opinion, what would be your biggest weakness?
Um, oh, so I think again, we all have weaknesses, and I'm not an exception. So my biggest weakness would probably be coming on as strong and passionate early on, and sometimes it might be like too quickly for people to sort of handle. So this kind of energy. So I learned how to communicate this with
Mhm.
my team members, and just to sort of adjust my pace accordingly. And yeah, I don't experience any difficulties with that anymore.
Okay, very good, very good. My next question is about a potential scenario where you run into a conflict. Let's say that you start your residency, you run in a conflict with one of your peer, let's say another intern. So tell me, how would you approach that situation?
Sure. I mean, I think um, trying to be a good team player and a team member. But certainly, if there is a conflict situation, I would definitely talk to my co-intern and clarify the situation with him or her, so we can come to a common decision, and just come up with a, let's say, management plan or treatment plan. And I think everything can be discussed in these terms. And if it comes to the patient care, depending on the exact situation, after that, if we do not come to a sort of conclusion together, I could be talking to my attending, and we can, as a team, come for a certain you know treatment course. And
Mhm.
yeah, again, that's something that we can sit and discuss and come to a decision together, for sure.
Okay, very good. Yeah. So conflict resolution is all about trying to directly talk to the person, because that is the most important thing. A lot of time we run into conflicts and we just escalate it without talking to that specific person,
Mm-hmm.
finding out that it wasn't a big thing. But yeah, if you, after discussing with that person, if you still feel the conflict is there, then we usually try to follow the chain of command. Usually, in most of the places, you could talk to your senior resident, even the chief resident would be the person. And if it's still there, of course, you can even talk to the program director and chair of the department. Okay. So you have told me about basketball. So tell me what other stuff you do in your spare time. What are your other hobbies?
So I like sightseeing. I enjoy city life. So here in New York, I have ample opportunities to do that. I also like hiking, snowboarding a little bit. So yeah, cooking, exploring new food places. There are quite
Okay.
many.
So you said cooking. What kind of food do you cook?
Many different. I would say mainly our national Kazakh cuisine. So,
Mhm.
there are many sort of meat dishes, because it was influenced by the nomadic way of life of our
Mhm.
ancestors. So,
Mhm.
they did, certain. They use certain techniques to preserve meat. So,
Mhm.
like, it's dry meat or smoked meat, and salted meat. And it actually takes a lot of patience to uh, cook those dishes, but it comes up
Mhm.
really delicious. And I think
Okay.
everyone should try like once in their life. So there is a dish called beshparmak. So it's basically
Mhm.
boiled chunks of salted meat and
Mhm.
pasta shit. So it's very simple, but comes up really delicious, as I said.
Okay. Well, patience is a virtue that we should possess in all sorts of situations. So very good, very good. So, I think we had a great discussion. I had ample opportunity to ask you questions. Now, I would request you to ask me if you have any questions regarding our program or anything related to the city or anything at all.
Absolutely, yeah. I I'm actually very interested in one of your initiatives with the closeting clinic. Um, is there any opportunity for internal medicine residents to get involved with this initiative?
Yes, yes, of course. So while you're doing your internal medicine residency, you would always get a chance to do electives. And though, unfortunately, I actually am a big advocate of having the internal medicine residency, having core psych rotations, but the ACGME does not feel likewise. But you could always do an elective in psych elective, neurology, whatever elective you want. And
Mhm.
we could definitely ask our psychiatry department to actually have you rotate into that clozapine clinic for sure.
Yeah, that sounds great. Yeah, that would be interesting. Thank you.
Any other questions at all?
So yeah, I listened to the residents and the slide deck, and I think I don't have questions at the moment. So yeah, thank you so much for your time.
Okay, well, thanks a lot for showing up for the interview. Best of luck for your interview trail. Thank you.
Thank you so much. Bye.